So when I saw and heard about Project Echo, for me, one of the things that was really exciting was the opportunity to be able to leverage technology to train, upskill frontline healthcare workers, and also use it in other sectors, whether it's in education or livelihoods or that sort of thing. Why is this important to us in Africa? It's important to us in Africa because with about 12% of the global population in Africa, Africa carries, according to WHO figures, Africa carries 24% of the global disease burden. And yet, we're only home to 3% of the global healthcare workforce. And when it comes to financial resources, we spend about 1% of the amount of money that's spent on healthcare globally. So when that's the context, it means that the very limited healthcare workers that we have and the limited financial resources that we have available to us, we have to look at how can we use this workforce in a more effective manner. If we start in Namibia, where ECHO started, ECHO was initially used in Namibia to support HIV and AIDS programming. And the context is that Namibia is a large country. It's a sparsely populated country. And because of that, there were long waiting times, there were delays in starting patients on medication. And what ECHO did is that by connecting the capital in Windhoek to these peripheral healthcare facilities, instead of moving the patients, it became possible to move the knowledge, to move the information, to move the medication that was required to the patient, instead of having to move the patient to come and see the specialists. The net effect of this is that it cut down the waiting times for patients to be seen. It reduced the time to patients getting started on the necessary treatment or getting treatment adjusted as necessary, and therefore led to improvement in patient care and saving lives.